Are you considering another cortisone shot for your knee pain? Before you schedule that appointment, let me share something that might change the way you think about injections altogether. Hi, I'm Dr. Jason Hahn, board certified sports clinical specialist in physical therapy. I've had the privilege of working with everyone from professional athletes to weekend warriors to everyday people who simply want to stay active, mobile, and pain free. And today, I want to talk to you about cortisone injections, what the research says about their long term effects, and some regenerative alternatives that could actually help your knee heal instead of just covering up symptoms. Now, cortisone injections aren't bad. In fact, in certain situations, they can be very useful. If you're in acute pain, if your knee is swollen and inflamed, cortisone can calm things down quickly. That's why doctors have used them for decades. But here's the issue. Cortisone is ultimately a band-aid solution. It suppresses inflammation, but doesn't address why the inflammation is there in the first place. And repeated cortisone injections can actually cause harm. For example, a study published in the Journal of the American Medical Association followed patients with knee osteoarthritis who received cortisone injections every 3 months for 2 years. What they found was eye-opening. Not only did cortisone fail to provide long-term pain relief, but it also accelerated cartilage breakdown compared to patients who didn't get the injections at all. Think about that. The very treatment meant to help protect your knee may actually speed up the degenerative process. So what's the real goal? It's not just about shutting down inflammation. It's about achieving what we call inflammation resolution. Here's the difference. Cortisone puts the fire out temporarily, but inflammation resolution is about helping your body finish the healing cycle so the tissues in your knee are actually repaired, stronger, and more resilient. Chronic inflammation happens when your body gets stuck in the middle of healing. Instead of progressing, the tissues stay irritated and painful. That's why so many people feel trapped in cycles of injections, medications, and frustration. This is where regenerative therapies like EMTT, also known as extracorporeal Magneto transduction therapy, and shockwave therapy, both radial and focused, come in. These technologies don't just mask pain. They stimulate your body to heal itself. Shockwave therapy sends acoustic waves deep into the tissues, increasing blood flow, breaking down scar tissue, and triggering new cell regeneration. EMTT uses high-energy magnetic fields that penetrate deep into the joint and surrounding tissues, energizing your cells at a metabolic level so they can function better and resolve inflammation. The best part? Instead of weakening the joint like repeated cortisone can, these therapies actually encourage stronger, healthier tissue. I'll give you a real life example. One of my patients had been told by multiple doctors that her only option was a knee replacement. She had already been through several cortisone injections, and each time the relief lasted shorter and shorter. By the time she came in to see us, she was in pain just walking around the grocery store. We introduced a program combining shockwave therapy, EMTT, and customized rehab exercises. Within weeks, her pain was dramatically reduced. But more importantly, she was regaining function, the ability to walk, climb stairs, and play with her grandchildren without wincing. Her story isn't unique. We've seen athletes bounce back faster from overuse injuries, and older adults regain mobility they thought was gone for good, all because we shifted from masking inflammation to actually resolving it. So before you get that next cortisone injection, ask yourself, do I want temporary relief that might cost me in the long run, or do I want to invest in treatments that help my knee heal and last longer? Your knees don't just carry you from point A to point B. They carry your ability to stay active, to play with your kids or grandkids, to hike, to run, to simply live life without being held back by pain. If you've been frustrated by the cycle of injections and pain, I encourage you to explore regenerative therapies like EMTT and Shockwave. Here at HealthFit, we specialize in helping people just like you not only find relief, but actually rebuild and strengthen their joints for the long term. If you'd like to learn more or see if you're a candidate, give us a call, visit our website, or drop a comment below. We'd love to help you take that next step towards true healing. Because when it comes to your knees, you don't just need relief, you deserve resolution. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.